But I am honored to introduce a speaker whose name you did not find listed in the program because she's another one of the surprises that the staff orchestrated for Randy. Dr. Pam Davis, Dean of the Case Western Reserve University School of Medicine, is here to offer some words. And since she's right here, I'll just stop.
Well, I have to say that when deans are invited to speak, they oftentimes their talks fall into one of two categories. What your mother taught you. Welcome, please help, and thank you. Or things that nobody else wants to talk about or in the way that you talk about it. So, finances, research data, student data. Nobody cares about the overall data. It's only how it relates to them. So this is an unusual talk because I think every one of you in this room could give this talk from your own personal point of view. And I think every one of you would have a very compelling case to make because I get to talk about Randy Cebul. And it's my honor and pleasure to be part of this wonderful event to talk about Randy. Randy is absolutely a foundational figure in improving health in Cleveland, someone who has always done what it takes, brought the right people together, inspired them to make real and substantive changes, and followed his passion for a better, healthier Cleveland. I think everybody in this room would want to applaud you for that and would agree. So the Better Health Partnership is one of your enduring legacies, and I think that this was an extraordinary, visionary approach to taking care of patients. It was risky. Things were not done this way. Think back 10 years ago and think about having practices and convincing practices to have the guts and the vision themselves to share their data comparatively on a public website and to be willing to commit to improving their performances. That was remarkable. It was also risky because the health problems that you were willing to tackle were at one time considered basically insoluble. You know, the health disparities, the difficulties in handling these chronic diseases. But you got over 700 people and initially more than 40 primary care practices to take part in the process of coming together. And they were willing to be measured against national standards and against their peers here. And you followed, and to follow your premise that you can improve what you don't measure. The summits were another innovation that allowed people to come together, as you put it, in safe space. And this is a superb forum in which to share ideas, and it's clearly been effective in improving health in Cuyahoga. It was an amazing accomplishment to get all these practices to participate in the first place. And it's even more remarkable that now those 44 intrepid practices that came in initially have grown to over 90. And we've expanded the Better Health Partnership to children, a move that I have very much applauded and encouraged. I still am amazed. I still am, it's still breathtaking to me that in the first 3 years of the partnership, hemoglobin A1C in about 27,000 diabetics fell by a whole percentage point, enough to change amputations, enough to change eye disease, enough to change kidney disease. That was an incredible achievement. It also was incredible to me that after many false starts as to what the EMR does for you, you showed that it was helpful in conquering these problems. And it was also breathtaking that over the next 4 years, the health disparities gap between blacks, Hispanics, and whites began to close. Now, nobody's happy that only 55% of patients get the kind of process care that we want, but closing that disparities gap is nothing short of remarkable, and I'm so pleased that we're moving on to childhood obesity and asthma. So I kind of think that, especially in healthcare, every dream creates a responsibility. If we can imagine a better way to do things, we have a duty to our patients and their families to try to make it happen. Not just once in a while, but consistently, time after time. And this is something that Randy knows and lives by and models. It's a philosophy that the partnership embodies. He had a dream, and he worked hard to see it fulfilled. Now, you know that Randy's a hometown boy. He really loves Cleveland. But actually, you really love your Cleveland, right? He views our residents as friends and family, and he goes to bat for them every day. As you know, you've seen, he has a mind for data, but I think his gift is that he sees beyond the numbers to the individuals and the families behind those statistics. The seeds that he helped plant 10 years ago when he oversaw the highly competitive process to obtain that initial funding from Robert Wood Johnson are blossoming today and will continue to blossom for many decades to come if we take up the responsibility to continue that. This is a true and enduring contribution and an achievement of lasting consequence, and it will only be enhanced by the Children's Health Initiative, which will help assure that every child has a chance to thrive. So, Randy, we want you to know that your efforts, insight, and creativity in addressing seemingly insoluble problems, we recognize them and we greatly appreciate them. You did the right thing. You did it in the right way. I salute you.
My goodness. I have nothing prepared. Oh no, right. Thank you so much. It says, with gratitude for helping to make Northeast Ohio a healthier place to live. It is important to me, and I think it's important to everybody in this room. I actually have been tempted, since we're in this citadel of free speech, to wonder where we should be going next, and there, we all know that this is a competitive environment in healthcare, and it's only going to get more competitive in some respects, because we shouldn't have so many beds and so many hospitals, and we really shouldn't be rewarded for having diabetics who come in to have their leg amputated. We shouldn't be rewarded for asthma than COPD in obese youngsters who smoke. That just isn't what we should be rewarding. And we should be cooperating, and there are some opportunities, I think, out there. I'd be interested in others' views about this, but we had a Learning Collaborative Summit just in April. We had the leaders of some ACOs in the region on a panel, and everybody was talking about success in accountable care organizations and population health. Those were sort of the two themes, the population health idea was clearly embraced by everybody, but as competitors to others. And so, but if the population health improves, shouldn't we all benefit from that? And so, to the extent that we go upstream, I guess is what they say, upstream, and we look at policies that affect whether it's tobacco or whether it's sugary drinks, everything that Tom Farley talked about when he came from New York to Cleveland last year or the year before, that New York did, and New York has really done some amazing things. But if we have less smokers because we we advocate. We don't need necessarily as physicians to know anything about policies, except we know what the results should be. Lower smoking, lower rates of sugary drinks being sold, and so forth and so on. And if the health improves of the population, the ACOs are going to have better results based on forces that are above us as it goes with regard to clinical care. We don't have to. All we have to do is vote for it, advocate and vote for it. The other thing is that in the last few years, tax policy has changed. For organizations to be tax exempt, they have to have a community health needs assessment, right? Isn't that what that's called? Turner or something like that. Anyway, and so they have to document what community they care about. And because it's public domain kinds of information, we got the one for Rainbow. And I'm talking about Rainbow because there's nobody here from Rainbow, I guess. but in any event, what is their community that they are doing a needs assessment for? Well, it's Cuyahoga County. It's the same as what we started out as, Cuyahoga County. I haven't seen the clinic's community health needs assessment, but I'll bet it has Cuyahoga County as part of it as well. Why shouldn't we work together? We're saving our tax exempt status. So those kinds of things, I think that we are at risk in the competitive model in the same way that the tragedy of the commons plays out. Self-interest in a situation where you've got common aspirations for yourself as someone else, but in fact to worry only about yourself potentially results in a commons that has no food for any of the sheep that could have been planned for consensually. So I think that there are some things that stakeholders in the clinical arena probably can advocate for, but that also in advocating can make some policies at the upper levels that enable us to all benefit from competitors collaborating. So I think I'll stop there, but thank you so much. I can't believe it.